I'm just taking a measurement of my post-tibial tendon. This is up towards about there in the ankle, and it's the last slide, so I can't get any further up the ankle. I believe the lady who's taken these has taken a limited amount of photos, so I can't get further up the ankle to view or measure the tibial tendon up the top of the ankle here to hide the post-tibial tendon harvesting. Now these measurements are, one is this one coming along there, even though, one's that one, which is 5.9 centimeters, and two is this one here, which is 0.50 centimeters. And see how this post-tibial tendon is circular? It's not meant to be circular. The tendon stripper is circular. Now they're saying my post-tibial tendon is thickening. It's holding fluid and getting thicker. Now let's look at how thick a post-tibial tendon is meant to be according to literature. All right, let's look at anatomy, pathophysiology, and classification of posterior tibial tendon dysfunction by these people, and we'll see what the width of a tendon should be and the shape. So this is your post-tibial tendon. The black arrow indicates it. See how it's running down the back and see how it hugs there. And then it's meant to be an oval shape. So tendon length ranges from 12 to 15 centimeters in length. 12 to 15 centimeters. These measurements mean fucking nothing to these surgeons, by the way. I'll show you in a second. And the cross section has an oval shape with a diameter taking from 12 to 6 to 7 millimeters. So this diameter is meant to be 6 to 7 millimeters. Now this is my ankle. This is the post-tibial tendon here, hugging the medial malleolus, and then we get up to here, and you see there's like a cross. It looks like an endoscopic tool has been shoved down my tendon. Well, this is my great saphenous vein. They've endoscopically harvested that, and they would have shoved a tendon stripping tool down my post-tibial tendon as well. Now, we'll take measurements of a side-on view, because the axial view here, I think she stopped taking it like here, so you can't go up here and measure what the tendon's actually like above there. So they would have like stripped it down to there. So all this is relatively normal, but up here is not normal. I'll show you. All right, so we've taken a few width measurements there. Now, the measurements indicate that 4 is 4.7 centimeters. So up here is 4.7 millimeters. 3 is 5.5 millimeters. 2 is 5.2, and 1 is 5.5. So it's ranging from 4.7 to 4.5 centimeters. Now, they're saying that this is thickening, so it's getting thicker. Now, how's it getting thicker if it's smaller than my left? I'll take you through an MRI of comparison. I'll show you how much smaller it is. Just take a look at this. That's where I think that's where the remnants of the endoscopic tool to harvest my veins and tendons was slid down my leg. Now, tendon strippers, these tools, you can look them up. Tendon stripper, that's 4 millimeters, and then you've got 6 millimeters, 5 millimeters. They've probably used a 5 millimeter tendon stripper on me. Now we'll just go through the scars and I'll show you why they've exactly put it right on my post-tibial tendon when they've cut me. So the first ultrasound report I got before I had any MRI showed a small amount of fluid in the tibialis posterior tendon sheath, which may reflect mild tenosynovitis. The underlying tendon appeared intact and in normal thickness. However, I don't think this is the case. Now, Dr. Nicholas Hall is the person that did all the measurements. And now I went back to the doctors. Oh, shit. Now, I went back to the doctors and I'm like, he's like, Dr. Muhammad Udin's like, work it a lot, use it a lot, use it a lot. It's just mild. And I'm like, that's fucking bullshit. There is no way this is just mild. And then I went to see my own MRIs and this is what's on the MRI. So he's used one of these tendon strippers on me. All right. Now, what size incision? These are all endoscopic. They require a 2 centimeter incision into the ankle to be used. The stripper was put through this hole here. That's on the MRI. That's where it was shoved through, down my post-tibial tendon there, and stripped it. To 5 millimeters, and he's saying it's got fluid in it and it's thickening. Just said mild thickening. Now we'll go over to another MRI, which was done side by side. The woman who took that ultrasound that I showed you, this one here, was freaking out looking at me like I had stage 4 bone cancer. And then they're like, oh, it's nothing. Just another measurement, 1, 2, 3. We're coming in at 6 millimeters for that. And you can see the white on the side, which I reckon resembles the fluid in the tendon sheath. Now we'll go over to an MRI with them side by side. Here's the surgery report. Now, M. Jabbar from Iraq, trained in Baghdad. Peter Wong from China. Now, I'm probably not going to be able to read it enough, but it says entry medial to patellar tendon right above my finger. You probably can't see that, but they measured after they cut me open. So they cut me open here first through my patellar tendon, cut the side off my patellar tendon. This is the first cut they did, and then they took a measurement. You're meant to do pre-operative measurements, but they used a shorter size rod. So they took a measurement and then they're like, oh shit, we don't have a rod that's going to go to here. We need to use a shorter rod. Measured to 42 centimeters. However, longest nail available was 40 centimeters. So they use a shorter rod, which brings it up to here. Now, that is extremely significant because they manipulate the surgery to get to the soft spot to endoscopically harvest your veins and your tendons. Now, if they went in here in the medial malleolus, they couldn't do any of it. They'd be in the bone. So they use a shorter rod and go through. So when you talk about measurements, like when you say, oh, my nerve got damaged there, my saphenous nerve, because they used a shorter rod because the nerve is located here. It's not located in the bone. That's why they go in the bone. When you say something to them like that the shorter rod increased the nerve damage because it put it in the direct spot for the nerve, it literally means nothing to them. They literally, I don't get it. Because when I was a 12-year-old kid, I basically measure twice, cut once, right? And I don't understand why surgeons can't do it. Now we'll jump into another MRI. Unfortunately, they didn't give me this MRI in the Intel viewer program, so I can't take fucking measurements. But this is a jam-packed MRI with 330 images. This lady was definitely not trying to cover up what was done to me. She was trying to help me by taking images side by side in heaps of different ways. But it was just down to the Chinese radiologists to diagnose it, but they won't be doing that because that would mean admitting that they trafficked my organs and tortured me with an Iraqi before my cousin deployed to fucking Iraq to combat ISIS. So they're torturing and harvesting the family members of the Australian Defence Force, leaving them for dead while they're serving their country. Now we'll go through this MRI. Now, this is where I've had my superior extensor reticulum ripped out of me. That's my left leg. I've got it. Right leg, don't have it. Now, you try to show this image to the doctors. They're like, oh, they're taken side by side. They don't usually do this. I can't really tell what's going on here. It's not a good image. Oh, I can't look at it. Oh, I can't make this out. But one thing they can't do is just zoom in and focus. They just can't do it. They have a complete inability to look at this and tell me what's this? Why is this going on? They say this is an anterior ankle impingement. This is definitely not an anterior ankle impingement. They say this pain is caused by a saphenous nerve. But you can't, they will also tell you can't see nerves on an MRI, so why the fuck would you get one? And then they're just like, nah. And then I had to send myself to these MRIs. And this is what's on the fucking MRIs. Now, click over. See this fine slice here? Slice, cut through, anyway. Then we go through again. When I went back for help, they smashed me in the knees with metal bars during the first surgery. And when I went back for help to remove all the hardware because it fucking hurt, they put aborted fetus skulls in my knees over my pulpiteal artery and Satan sacrificing a baby, 5-pointed star. That one's crushed, piercing my lateral knee capsule, jagged, sharp bits by poking into my fucking arteries, okay? This is going to fucking kill me. And they're going to, masses of them are going to let me die. They are going to misdiagnose me to death. This is the measurement, well, what we were looking at before. See how circular that post-tibial tendon is? Because it's been stripped. And see how that's more oval as described? So it's coming down from the ankle as oval and it's coming up. And it should be oval. But instead, this one's circular because they've chucked a tendon stripper on it, which is circular. Unfortunately, I can't take measurements in this thing because they just gave me the JPEGs and not the Intel viewers. But this is a lot thicker in the MRIs. It's a lot thicker in the that's a lot thinner. And outside my body, it's a lot thicker in my left one instead of my right one, which I'll get to in a second. I'll just look for more MRI. This is a better MRI to show it. This is my left one. It's just thicker. Go to my right one. It's thinner. But they're saying my right one is sore because it's getting thicker. It's filling with fluid, getting thicker. But my left one's thicker and my left one's not sore. So if my left one is thicker, wouldn't it be sore? But it's just a bullshit diagnosis. Thinner, thicker, way thinner, thicker. This is just a better shade for showing tendons because she took multiple. Thicker, thinner. As I said before, I wish I could measure it. Alright, notice how every screw on this deck is aligned. There's boom, boom, in a line, in a line, in a line, in a line, everywhere. It's just, you can put it one after the other in a line. You just go boom, boom, one after the other. Now, this surgeon, after he's used the shorter size rod, the scars, oh, see the scars there? This one, larger one,
gone down on an angle. And this is the one they used where they took it out. You can't see it, but it's like right there when they took it out, because he went down straight. He just went down in a straight line. But when he's doing the surgery, he cut down on an angle along my post-tibial tendon. Now, why is he cutting down on an angle if he's some master fucking surgeon that's paid like 300 to 500 grand a year or some shit? Now, look at the left one, and you can just see that post-tibial tendon there. There's so much more of it. It's ridiculous. It's fucking ridiculous. You can flex it. It's got that oval shape that he's talking about. Then we jump over to this one. I can't even flex it. You see that scar there? Blue dot. Guess that's a fucking blood clot, because I've had a stent put in here. They've taken the veins out and put a stent in, taken my veins for someone else's heart surgery. By the way, when they were doing this, if I was a month younger, I could have been at a children's hospital, like seeing a pediatrician, operating on people from the age of 0 to 21. But don't worry, you can still see this guy at a children's hospital, because Dr. Majid Jabbar is a pediatrician. Harvested my organs, and he'll be operating on your kids at Lodi and Lee Lady Salento Children's Hospital. The Dr. Majid Jabbar from Baghdad. Oh my God. We'll try and make this post-tibial tendon flex. Try and make you see it. I can't do it. I'm trying as fucking hard as I can to make this post-tibial tendon along here flex, because it meant to hug the back and come along here. Instead, there's just so much more medial malleolus and so much more less mass. Now we'll do the left one. There you go. It's coming straight along there. Now, I'm a 6'3", 90 kilo male, so I have a bigger post-tibial tendon than most people. However, when I compare that post-tibial tendon there, now when I compare my right leg post-tibial tendon to a little girl's, the little girl has a bigger right post-tibial tendon than me. It can't even flex it. Foot's going black and blue. Can't get medical help. I even went in. Look, I've been to 5 hospitals because I just wanted to see the orthopedic surgeon instead, because I know I need an orthopedic surgeon. And then eventually I'm like, fuck, I'll go to ED and tell them the truth. Tell them I've been harvested by an Iraqi and I have aborted fetus skulls jammed in my knees, causing a pulpiteal compression, causing lesions, and it's giving me thrombosis. Can I video you right now?
You can video me right
cool.
now.
What's your...
My name's Warwick Isaacson. I'm one of the senior ED consultants here.
So, Warwick, you believe the best way to get me treatment for my leg is by not looking at my leg.
So what I'm going to say, Ryan, is that a large number of specialists have reviewed your images and also looked at your leg.
Yep. So you would rather tell me I'm crazy than to personally view the images, that I've caught some of your medical GPs slipping up about the images.
So Ryan, I'm just going to repeat the words that you said back to me.
Yeah.
If you're concerned that parts of your veins and your tendons have been harvested for other people to use, I think that's highly unlikely given my experience. And also you're concerned that fetuses' skulls have been injected into your knees.
Yep.
I think also is highly unlikely. And in my experience here, what I've found is that it may be that your mental health is then tying your mind in knots and you're overthinking what's going on with your leg.
Yep.
And that treating your mental health may well be the most effective way to help you.
What mental health conditions, what symptoms do you think I'm suffering at the moment?
So, because I've only got to speak to you for a short period of time, and mental health isn't my specialty.
So see, there you go. So many orthopedic surgeons have now looked at my leg over the past 7 years and misdiagnosed me that I can't even go to an emergency department hospital and get a fucking blood test or even for anyone to look at my leg. they'll just be like, you're mentally ill, you have to talk to the counsellor or some shit. Okay, here's some drugs, bye.